Today, it is a pleasure to introduce the long-awaited CSPED seminar. Dan Meyer and Maria Cancian. Not surprised, but really glad to see such a good turnout and a lot of our state partners as well. I assume everyone knows Maria and Dan, and I also promise to keep the introduction short. So I will say that they have both jointly and independently made huge contributions to anti-poverty, social policy, and family complexity literatures. They've both played huge leadership roles on campus. Dan continues to, unfortunately for us, fortunately for Georgetown. Maria recently started as the dean of the policy school there. I would say the two of them together are arguably the top 4 child support scholars in the country, if not the world. And this project has just been a huge part of the daily existence for the last 7 years. So I'm going to turn it over.
So I'm glad that Lonnie said we're the top 4, because a lot of times people think of us as one of the top between the two of us. So you may not, Dan may or may not ever let me flip a slide. The last time we did this, he controlled it, but we're going to go back and forth. We don't have mics, so if at any point we get too quiet or we're hard to hear, please let us know. It's not usually our problem. So you always have a lot of things when you have a project. We really have a lot of things here. A lot of folks in this room were our partners in either designing this evaluation, in implementing this evaluation or this project. And then there are a lot of people in here who worked very, very long hours cleaning data, finding things, running analyses, so huge thanks. We also owe a lot of thanks to partners who aren't with us today. This was conceived of and funded by the Office of Child Support Enforcement, which is a piece of HHS, of ACF, and you'll see some folks listed there. As is usually the case with lots of the work that Dan and I do, we had wonderful colleagues at the Department of Children and Families, and then also our county partners, and we thank them. Mathematica Policy Research was a collaborating institution with us, and we also worked with the University of Wisconsin Survey Center. We need to thank all of the grantees. You'll hear more about them and our partner staff. And Nina is with us here, so we have one person who actually suffered and will keep us honest as we go through here. So, we have to thank the over 10,000 non-custodial parents who volunteered or agreed to participate in this, half of whom received extra services, half of whom received regular services, all of whom completed a baseline survey and agreed to have us collect lots of information about them, many of whom also did a follow-up survey and other things, so, and who kind of worked through this program. Having thanked all those people, anything wrong, any opinions, all those things are either Dan's fault or mine.
So this is just a list of the people we remembered who participated in this project.
And we're old.
I was going to show a slide from us in high school, and then we had a little fight about whose high school pictures looked worse. That just to make the point of how long we've been working on this particular project. It's been a long time, and lots of folks have participated in this. So we're going to start with some background. It turns out not everyone knows a lot about child support policy, but so we're going to start with just some beginning stuff. We are open to interruptions, so we'll take that stance until it becomes untenable, if it does, and then we'll change the rules. But right now, we're happy to be interrupted. So this project starts because many of you know that there's been dramatic changes in family structure over the last 50 years in the United States. So increases in single-parent households, the more attention as a result to the child support system, the child support program, trying to figure out ways to ensure that non-custodial parents contribute financially to their children. There's lots of child support policy that some people in this room know more about than me. But the basic story is the child support system doesn't work very well for lots of families. It does work well for some families, but for lots of families it doesn't work very well. And here's the national data. fewer than half of the custodial parents say they were supposed to get some money in 2015. And of that 43%, fewer than half got the full amount that was due. So a system that doesn't work very well. Why doesn't it work very well?
It works well for a chunk of people, and that's largely because the non-custodial parent, often the father, has formal earnings, and child support is often automatically withheld from those earnings. So just like paying your taxes every month, you pay your child support. But a lot of the folks who aren't regularly paying child support aren't employed. So many non-custodial parents have limited earnings and ability to pay. Many non-custodial parents, you'll see in our sample, about 2/3, owe support or have had children with more than one partner. And so they just don't have the capacity to support all the children that they have, maybe. And in addition, there have been some challenges with the program itself. The focus has been primarily on enforcing collections. And this is really the way the program was designed. So this isn't kind of saying, oh, well, these folks were supposed to be running a social service program and they started doing the wrong thing. The program really was designed in a lot of ways to be a bill collecting program. And that has kind of changed over time. But the tools, a lot of the tools that agencies were given were about sanctions, about taking away people's driver's license, about kind of threatening folks, and not always a lot of resources for providing services that might help folks. And there was a growing sense in the literature and in the policy community that you might benefit. We might get better outcomes, not just for non-custodial parents, but also for custodial parents and children, if we had a system that would, in the words of Ron Mincy, enforce and enable, to allow people to do things. One other issue here that we didn't highlight explicitly is because of assortative mating, because folks tend to marry people who are like them. The folks that are struggling, the non-custodial parents who are struggling the most to pay child support, often owe that child support to the custodial parents and children who need that money the most. So it'd be bad enough if we had a system that randomly didn't work for a bunch of people, but it particularly doesn't work for the folks where it's most important that it work.
So this sense that the current system may not be working very well, but unclear so far what might work better. So in the fall of 2012, when we were younger,
about 20 years younger.
OCSC issued a FOA, so they competitively awarded grants to 8 states, child support agencies in 8 states, who would try a new approach. And the new approach would be targeted for folks who were struggling to meet their obligations and who had employment difficulties. And they were going to be given enhanced services. So grants to 8 states that would provide those services. And then a cooperative agreement to Wisconsin DCF, who would be the evaluator, who would manage an evaluation of this intervention. And DCF chose us, the IRP, along with our partner, Mathematica, to do the evaluation. And then this demonstration ran itself from 2013 through 2017. And we're now able to share the results of the impact and benefit cost evaluation. But before we get to the impacts, we need to talk a little bit about how the program was designed.
So the basic idea here is that you have a child support-led program, and that's really innovative, and we'll talk a little bit more about that in a minute, where the child support agency provided leadership and oversight and coordination, and also provided enhanced child support services and some screening for domestic violence. Child support agencies were encouraged to partner with partners who had expertise in providing parenting services and employment services. And then there was also case management that was provided either by the grantee or by a partner agency that included needs assessment and kind of coordinating services across the 3. Now, this configuration looked a little different across the different sites. So here's a map that shows you we had 8 partners in 8 different states, but in some places like California, it was 1 county. Some places like Wisconsin, it was 2, Brown County and Kenosha. Some places like Colorado, we had 5. So we had altogether 18 sites across 8 different grantees. And we won't talk a lot about differences even across grantees, and we aren't going to talk at all about differences across sites today. We mentioned that this was child support as a lead agency, so here's just some pictures from different child support agencies. They also worked with partnering agencies. So on the next slide, you'll see some of the fathers partnership and other agencies. Now, the reason that we focus on this is not just because bureaucratically it's kind of interesting to try to coordinate across 3, but because part of this project is really focused on culture and mission change. CSPED was really a project, not to put words in OCSE's mouth, but I think that was motivated in some ways by an interest in understanding whether this different, more holistic approach to child support would be more productive. And part of the reason that's so important, there's a couple quotes from the implementation analysis, and Jennifer Noyes, who led that effort, is here, and Lisa Kleinvogel, who has also played a leading role. We did a lot of interviews. We didn't. They did a lot of interviews. And this gives you a sense of some of the challenge of a child support-led program. This is saying the perception is nothing good comes from child support. That kind of gives you one sense. Child support has such a negative rep for decades upon decades upon decades as a collection agency. So I won't read the rest of that quote. But really, there was a sense in a lot of these communities, and it varied across, but if you're getting a letter from child support, it must be a sting. It must be they claim they're offering you these services, but really they're bringing you in to arrest you. Remember, everybody pretty much who we were recruiting was having trouble complying with their child support orders. So they were folks who were not succeeding. So you might say, okay, given that, why would you organize this as child support led?
And so here's some of the advantages of doing that. Child support agencies have several things that they can do really well, and in some ways are uniquely able to. So they have access to the target population. So if you think about what services there are for men, low-income men in the community, really there's no sort of key agency. And child support is one place where you can reach the target population. They have information in the child support agency about the full family context. So not just someone's current partners and children, but the history of them and the history of their obligations. And then they can take direct action if the child support program itself is part of the problem, then maybe the child support agency could undo some of those things. So maybe a simple example is one of the things that happens when you're behind in your child support payment is they can take away your driver's license. All right, so who in this room thinks that having your driver's license taken away enables you to be successful and pay your child support? Well, okay, so nobody, right? It's sort of a threat that you hope motivates people to do something, but you don't ever want to carry it out. Incarceration, the same way, right? If you don't pay, we're going to put you in jail. Well, if we do have to put you in jail, that's probably not going to lead to a steady stream of child support payments. So this notion that child support itself might be part of the problem, and so if you have a child support agency running a new, more holistic intervention, then they cannot take those actions quite as quickly, or maybe not take them at all.
So that gives you a sense for kind of the context. Do you want to?
Yeah, and then here's the evaluation.
So it's many people will be in this room will be familiar with this kind of a design. All of the grantees and all of the sites are part of a a kind of standard RCT. This is a place where we really did rely on the expertise and experience of Mathematica in kind of implementing a random assignment protocol, relying on some of the kind of, for those of you who know, this is kind of one of their main business, one of the main things that they do is implement these multi-site evaluations. And we had done that in Wisconsin, but we hadn't done a national version. So we really were it was very helpful to us to work with them on that piece. So we did that. We have an impact analysis, a benefit cost analysis. We'll talk very briefly about that. And an implementation analysis that has been really important in helping us to kind of put the other results in context. Our goals are kind of, there's two main ones, but I'll also highlight something else. So we wanted to determine how the programs operated and whether they improved outcomes and whether benefits outweighed costs. But we also wanted to increase our understanding of non-custodial parents' lives. So there's been some work on this. There are a number of projects, Fragile Families, other projects that have kind of engaged related populations, but we haven't had, Dan and I have done some projects in the child support space, but typically we're interviewing moms, or the focal sample is moms, that's where we're starting, or custodial parents. This was really a project built around dads. If we had had all the money in the world, our initial hope was to interview both moms and dads. But unlike other projects where that's what we hoped for, and when reality set in, we only talked to moms, that was what we hoped for, and when reality set in, we only talked to dads. So we have a lot of information about 10,000 non-custodial parents, about 90% of whom are fathers. And that's part of what we're trying to kind of leverage for this project. Our key question of interest, kind of the key question for the evaluation and for the program, is whether CSPED increased the reliability of child support payments. So not the level, but the reliability. Okay, so we'll talk a little bit more about that in a minute.
So this slide is linked to lots of panic and difficulty and trauma, really. So the grantees recruited in different ways. So sometimes they sent letters inviting people to come in. Sometimes they did recruitment within the court setting when people were in court for child support. But when they identified that someone was eligible, they explained the study to them, went through an IRB consent process, and then told people they had a 50-50 chance of getting extra services. And then they did a baseline survey over the phone. And at the end of the survey, people were randomly assigned. So the great thing is we have this baseline survey on everybody. That's definitional to being in the study. And so we used it for the implementation analysis, we used it for the impact analysis. There is a report that's kind of all we learned about the characteristics of low-income NCPs. That's available on the website. We're not going to talk about that much today. We did a follow-up survey, and this is really where the trouble came. So we have administrative...
Now, if the survey center were here, they might not agree with you on that, but that's okay.
So we have administrative records from 8 different states, sometimes multiple sites within states that did things differently, and we're trying to make something common out of those different ways of doing things. And that's a whole seminar in itself. I'll just say trouble. Then we had a bunch of other things that were used mostly for the implementation analysis. I will let you move the slide.
Because this is your comparative advantage. You have now established, there's a clicker. So now, okay, so now you are dust. Okay, so a key threat in this was the possibility of cherry picking. There are so many questions you would legitimately want to ask, okay? We've got, 18 sites. We have something that was done over a bunch of different years. We have dads that have lots of different characteristics. We're measuring all kinds of stuff, like about parenting, about employment, about child support. So, some folks involved in this process, came up with a list of 100 and some things that we should be testing. So all of you who've taken a Stats 101 class will say that if you have probability of less than 0.05, you're going to find some stuff if you do that. So we needed to really shrink that. So our approach, we didn't quite, so now it's sort of trendy to like pre-post what you're going to do like on the web, but we did have very detailed documents that we shared with our funders that said these are the things we're going to measure and this is how we're going to measure them and these are going to be the outcomes. And see, now we'll see if I can do this. We had ouch, 14 primary measures across 7 domains. So this is what we're going to talk about today. Child support compliance. So that was our measure of kind of the reliability of child support. If you're a custodial parent and you are owed $200 a month, what percentage of that $200 a month did you get? Now we had lots of other measures, like how many months did you get, at least 70, we had other measures, but we had to pick one that we would do. So what we did was child support compliance, total amount paid over the total amount due, and we did that in the first year and the second year, and we used administrative records. So we committed to that.
Just for those of you not knowing the lingo, this current just means sometimes people pay on their back stuff they owe. So current just means you're supposed to pay this much this month. How much of that did you pay?
And we used up some of our extra measures by also having child support paid and child support orders. And you might ask, like, why not just have compliance? And part of the reason is you could imagine, like, people are interested in each of those pieces differently. So you could imagine that you would, if I could guarantee 100% compliance for everybody by just setting their order to 0, right? And there are jurisdictions where in order to get, better performance, they're making their orders very, very low, or they're zeroing out orders for people they think won't pay, right? So we are interested independently in what happened to orders, what happened to payments, which is, after all, the money that kids see. And then we're also interested in compliance because not complying with an order has negative consequences for non-custodial parents. So we care about all of those things.
The next thing we wanted to highlight was an attitude towards the child support program, or satisfaction with child support services. So there's lots of ethnographic evidence and almost no quantitative evidence on the levels of satisfaction, or sort of how non-custodial parents. Yeah.
I want to go back and understand the current thing.
Yeah.
Current paid for, so if I miss month one.
Oh, you already did that?
If I miss month one and then I make full payments every other month,
Yep.
I'm always a month behind.
Yep.
So current payment would be 0. Is that right?
No.
Or no?
No.
No. The amount, when you just kind of technically put aside tax intercepts for right now, if you make a payment, the first thing it goes to is current support.
Okay.
So if you owe $200 a month and you pay $150, it'll all go to current support. If you pay $300, $200 of it'll go to current support, and the $100 left over will go to back support, roughly speaking.
But if every other month I pay a full 2 months, that's
Yes.
going to be 50%.
Yep.
Is that right?
No.
No. So 0 on the odd months and double on the even months. 50%. That's what this.
That would. So I'm going to accidentally give a more technical answer. So child support workers have the opportunity in some states to date the payment with what they think it should be. So probably you are correct. 50% is what would show. And then in our measure of payments toward current and arrears, then we'd show the whole thing. But it's possible that people who miss, the way I think about it, people who miss a day or two, that usually gets fixed within the discretion of the system.
And we did a lot of work to try to make sure that we weren't mismeasuring when you made one payment on the first of the month and then a second payment on the 30th, because things get taken out of paychecks, and paychecks come at beginnings and ends sometimes of periods.
And here we're summing what they owed over 12 months and what they paid over 12 months.
To
right?
current
So
support.
if they paid twice as much in one month, we would be captured in that,
No.
No.
Leslie Hodges, who did
Sorry.
who did a lot of this work. So when states gave us information, they said whether this was for current or for arrears. So what we would have done is totaled whatever the state said was for current for those 12 months.
And we tried it, I mean, the bottom line is we tried it different ways and it doesn't matter for the.
So it's a complicated wrinkle that turns out not to matter very much.
But it gives you some sense of why it was really hard to get comparable data across all these different sites, because the practice varies and the information systems vary. So for employment, we had UI records, and there's kind of a national system that kind of gives you relatively comparable data. But for child support, and less so for benefits, but especially for child support, there's quite a bit of variation in what we actually had to work with.
Okay, so yeah. Attitude towards the program. So this is from the survey, and it's about your level of satisfaction with child support services. Then, as Maria just suggested, we do have some administrative records on employment and earnings. This comes from the national data systems. There's also survey information that we use for hours worked, proportion of months. And so the survey compared to the administrative data. So the survey, you might pick up more informal earnings, informal work, other things too. And the administrative records, you might miss that, but measures are not subject to memory problems or desirability biases, et cetera. And then we got one measure of parenting. And so what we picked, and you'll see our operationalization of this in a minute, is the sense of responsibility for children.
Do the next one.
Okay, so this is a standard method here. We're just trying to first figure out if the two groups are equivalent at random assignment, and if so, we're going to do regression adjusted differences. We're going to do it within grantees, and then we're going to show the average across all 8 grantees. We're doing intent to treat, so for those of you who are familiar with that language, I don't have to say anything else for everybody else. So this is about the offer of services, not whether people actually received services. Turns out that because of what I just described about when people were randomly assigned, almost everybody got something, because we had them at day 0 or day 1. So almost everybody got at least some initial assessment and some initial services.
So now this is false advertising, because we're going to talk a little bit about enrollment, then we're going to skip all the slides on baseline characteristics because I looked at the clock, and then we're going to get to the results. So enrollment, we enrolled between 2013 and 16. Our goal was to have 12,000 participants. We got 10,161. As required by OCSE with respect to the programs, all the participants had established paternity for at least one child, had one or more cases that were receiving child support services, and had difficulty paying or were expected to have difficulty paying child support due to lack of regular employment. Jeff?
How many people who would have been eligible to participate in the study declined to do so?
Very few.
That was true in Kenosha. Very few.
Okay.
I love having you here, Nina. Nina ran the program in Kenosha County, so one of 2 counties in Wisconsin.
Okay.
But there were people who would have been eligible who didn't come in.
Right.
Who didn't respond to the recruitment efforts in the first place. Mm-hmm.
Yes, so we're careful in talking about some of these results. When we're talking about the participants, these aren't necessarily, you can't generalize to all low-income non-custodial parents who are having trouble with child support. In different locations, you could generalize more than others because of the way the recruitment went, but you couldn't. And you also, we're going to be making some strong claims about child support change, culture change. You cannot arguably generalize from these 8 grantees to from Nina to all of her colleagues, right? Wisconsin is a very innovative place on the child support space, and not everybody volunteered or put together a grant proposal to go after CSPED. There were quite a few did, but 8 were selected for a variety of reasons, but you can't generalize that what was accomplished in these particular jurisdictions could necessarily be accomplished elsewhere. So this is the only other slide and the only baseline slide we're going to talk about given time, just to give you a sense of the folks in this.
So 90% men, average age 35, lots of people of color, pretty low education levels. This is brand new, so nobody really had a number for this before, but that's a pretty high level of depression. So this, as Maria already said, so lots of people who had kids with more than one partner. This maybe surprised us a little, so about a third who had a kid living with them in addition to kids living elsewhere that they were supposed to be supporting.
Yeah.
That's
and
how
not
much time we have.
Yeah.
Lots of
stuff that we're not going to talk about this. Not going to talk about that. Okay.
Lots of people
We
with criminal
agreed.
justice
Yes.
histories.
We agreed that if we weren't
Yeah.
here, we were going to skip to here. So I hate it when people come and give seminars and don't get to the results, right? So we should get to the results. So 3 preliminary questions before sharing the impact. Question 1, did randomization work? I'm just going to say, yes, it did. Trust us. It's in the report because we got to move on.
Second
Question 2.
Oh, go ahead.
You go.
Was an RCT necessary? And we say yes, and here's what we saw. So this is the unemployment rate in the 8 different states over our period. And so mostly as a result of this, the people who didn't get extra services, so the control group, did better every year, right? So employment rates up, earnings up, annual child support payments up, everybody doing better. And so just a little story. So the people running the programs thought that the people they were serving were doing better. And they were doing better than they had been doing. It's just that you need the random assignment design to see if they're doing better than someone just like them who didn't get the same services.
Third question, did the extra services group actually get more or different services? Was there a treatment? And yes, the answer is yes. They reported more child support, employment, and parenting services. And these are from participants' reports. And so one thing to recognize is you'll see they reported an average of 14 additional hours, which includes, for example, 1 additional hour of child support services. There may have been workers working a lot more than an hour to help them. They wouldn't necessarily observe that the way that they would observe how many hours of parenting services they got. Employment services is kind of a mix, right? But we do see a difference. There's the difference for E's and C's. So there was a treatment, and we'll talk a little bit more later about whether it was a modest treatment or more. Another thing that's really important to recognize in this context is that part of the treatment was less treatment in some sense. Participants in the extra services group were less likely to be subject to kind of punitive enforcement actions. So they were less likely to have a contempt hearing, a warrant issued, a license suspended. So this really was a less punitive approach to child support. Jennifer.
Is that from admin data or from the follow-up survey?
This is from admin data. Yeah.
Those are small, really small.
These are small, that's right.
Yep.
They're small differences, but still you get some idea of how often these things happen.
Yeah.
And then you don't know who didn't select in either, because they could have been ones who are most afraid of this exact sort of thing.
Absolutely. Okay, results.
So the first one, and all the results are going to look like this with extra services or E's in this purplish color, and the orange is going to be the regular services or the C's. You remember that we're looking at first year and second year separately. So orders lower for the CSPED group. And these are monthly amounts, so this is in the order of $15 a month. So this is perhaps not surprising. So you look at somebody's order. These are people selected, after all, who were disadvantaged and having difficulty paying. You look at their order, you compare it to, every state has some formula as to what orders should be. And so mostly we think of this as probably right-sizing orders, making orders more consistent with what the rules say they should be.
So here's the impact on child support paid, and just in case you didn't notice, child support owed, 3 stars. This is this kind of result is pretty robust to different ways of doing things. The decreases in child support paid are smaller in magnitude. They are less significant in this particular measure, which is the confirmatory measure we had. They are also less robust in the sense that we had quirky data from one of the grantees. When we throw that grantee out and do it over 7 instead of 8, this loses significance. If you adjust for multiple comparisons, this loses significance. So it's small, you know, there it is, not much. And so maybe not a big surprise that we see no impact on child support compliance. And if there were one measure that were the central kind of hope for this, is that you would see an increase in compliance. Now, I think it's worth kind of thinking about this. You're providing services which you hope will help people to pay more and comply more. You're also being a lot less aggressive with enforcement. So you could imagine that what you would see is a big decline in compliance, right? Because we're not suspending as many licenses. We're not arresting people. We're not kind of harassing people as much. So you might see that you would have expected compliance to actually go down. So we don't see that either. So it's kind of a half empty, half full. On the other hand,
so here's the biggest, and in case you're leaving right now, this is the biggest and the strongest result, is how satisfied they were with the services they got. So this is very satisfied or satisfied with the services of the child support system, and you see, 22 percentage point difference. This is large. This is consistent. Every grantee. In the grantees where there's enough sample size, you said we weren't going to talk about sites,
okay.
But I'm going to say something. Where we can see site differences, it's true in every site. So something happened. A transformation in how people felt about the way they were acting with the child support system.
And this is, and I do see you, Jeff, this is part of why we gave the context we did for the child support kind of leadership here, is that this is, this is a important theme in the academic literature. This is an important part of the policy dialogue. This is a real challenge for child support agency leadership. That as we've come to understand, fathers' roles as being maybe more than just providing money, and child support agencies as doing more than bill collecting, it's great if we decide we're doing something different, but if the folks that we're serving can't be convinced that we're going to try to do something different, then we're just not, that's really going to be an issue. And so one of the real open questions behind this was, if you had this, arguably somewhat modest change, would you actually see people changing their mind about what you were doing? And so I got to say, I was kind of surprised to see this much of a difference. I was particularly surprised because we're comparing people's reports, and this is a culture change, and I expect that some of that culture change bled to the rest of the agency, right? So that, that if we really could measure what what no intervention looked like, we would actually see lower satisfaction. This is purely speculative on my account, but this is the difference comparing people that were in an agency engaged in this project but were just getting regular services to people in an agency engaged in this project who were getting extra services. So it's a big difference.
So right here,
Jeff,
Lori,
yes.
we could have talked to the CPs.
Say more?
Well, because of the some of what we were seeing and hearing was around some concern on the part of the custodial parent that you're giving the non-custodial parent a break, and yet I'm not getting any money. Not only is the order gone down, the compliance is going up. So what's in it for me?
Yeah.
Right. No, and I think we have problems on both sides, because I think on the one hand, some custodial parents would feel like, you know, why are you being nice to this guy who's behind? On the other hand, when you look at like the CPS question about why don't you have an order and why aren't you pursuing an order, one of the most common, I think the second most common response is because the non-custodial parent is doing what he can. And, you know, I'm not gonna, in some sense, people will tell you, I'm not gonna, it's just gonna make things worse if I get you guys on him. So some CPs were probably not happy about the NCP kind of being dealt with in this other way. Other CPs arguably might have been happy.
But
so
we-
it's really hard, but we weren't able to do that.
We don't have that measure, but
And
you're right. So a measure of satisfaction with services could be done on their entire population, and we don't have that.
And if we were 20 years younger, we would say we wanted to redo this with, no, we wouldn't.
40 years.
40
yeah.
years younger. Okay, but we're not doing it. For either reason, we're not doing it. So to summarize, reduction in child support, smaller reduction in child support payments, but they were smaller on a smaller base. No impact on compliance, substantial increase in satisfaction. The report reports on a bunch of secondary measures. Just a couple things to highlight. In the first year, we see that orders were less burdensome, where burden is a measure of the percentage of your income that orders account for. There was less owed on arrears at the end of 24 months and on state owed arrears at the end of the second year. Now to talk about employment.
Number of months employed, number of quarters employed, no difference. Now to talk about earnings.
I thought it was unfair for me to have the clicker and stand in front of that. So I was
going
trying
to
to
take
be...
the clicker away if I could do it without being caught on videotape.
Okay, we fight like this all the time. So on earnings, we have kind of mixed. So total earnings, no statistically significant difference in the survey. So these are self-reports, pretty detailed set of questions. But we had NDNH administrative data on earnings for the first and the second year. And we see, you know, not just significant at the 0.1 for total earnings, higher earnings in the first year, but not in the second. And so, you know, in summary, no effect on employment, mixed results on earnings. We see small impacts on any employment over the 2-year period and some in quarters. But again, you know, this is, you know, if you want to look at the, how long is the impact report? It's very long. There are lots of tables. Dan carries it around, I do not. You know, you can find some things there, but, you know, not on our takeaway.
I mentioned earlier we had a scale for sense of responsibility for children. There's the 4 questions. And the news is that those in the experimental group had a higher score. So, but the difference is fairly small. So increased sense of responsibility for children. Jeff?
So under here are like 4 or 5-point Likert scales.
Yes.
Adding up
Yes. Yes. And we're taking the average. So these are pretty high scores, right? This is higher than a 4 out of 5.
Oh, I see. Okay.
That's not the only thing we did on parenting. That's just the confirmatory measure. So there's some other parenting measures. Ease with increased contact with non-resident children by about a day a month. Some P less than 10, evidence of decreased harsh discipline strategies. And then we looked at several other parenting things and don't see any significant differences.
And we looked at a bunch of other impacts and basically don't find much. No criminal justice, some impacts on economic well-being, a little bit of stuff on benefits, nothing on custodial parents, no differences. We had 4 subgroups that we looked at, no grantees, so we had 8 grantees. We did grantee-specific analysis. No grantee with substantially different impacts across all the domains. The bottom line of no impact on compliance holds across all the grantees. The bottom line, as Dan said, of big impacts on attitudes holds all across all grantees. And so now I'll break my own rule, and both of those also hold across all the sites where we can do it.
I just want to say one thing here. So interesting that with increases in earnings or 0 increase in earnings, depending on which of those measures you believe, there is increased SNAP benefits in 1 year. And so partly that's a result of the intervention, the case manager talking with people about their situations. And so some of this we think is the information effect rather than people having lower earnings.
So a few bottom lines.
I mean, maybe you can get to this as cost benefit, but you're finding not significant results, but how large an effect would you so if we compare this to job training programs or something like that, in terms of the amount of money that, are you?
We're getting to that.
Okay.
Yeah. I mean, well, go ahead. I'll let you finish
The
that.
question is, you can't reject 0, but can you reject numbers that you would have expected based on that literature?
Great. We're going to do that in the benefit cost.
So a few bottom lines. So can child support lead an intervention that has integrated case management, employment, and parenting services? We would say yes. And we would point to the implementation analysis, which really, I think, adds, and I can say this because I did none of the work, added tremendous amount to our understanding of kind of how the child support system works, the ways, the challenges, and some of the things that partners were able to manage in this process. So that's one bottom line.
Another bottom line. Can the child support program be changed to be less punitive? Yes. Although, as Tim pointed out, the differences were not huge. Does the new approach change attitudes? Yes. Now here, I think the differences are large, substantial. Does the new approach substantially increase or decrease payments and compliance? No.
So our third bottom line, why were the impacts, most impacts modest? It's a very disadvantaged population. It is a relatively modest intervention. So, if for this population, if you really wanted to move earnings, you might be thinking about, folks in this room. There are folks in this room who know more about what you would be thinking about, but more than what was provided. It's hard to evaluate programs that change culture. We talked a little bit about that. And there are reasons to be hopeful that part of the payoff of this will be in the longer run. If people, part of what we see with non-custodial parents getting in really bad positions is their kind of unwillingness to interact with the system, even when the system is trying to help them. So, you can have your child support order adjusted, but many non-custodial parents, won't engage in that. We know from other work, a recent report that Lisa did, that in a lot of counties, if workers know that the reason you aren't paying your child support is you lost your job or you have a health issue, they will, hold back on punitive enforcement actions. But if you won't talk to them, then they can't do that. So this change in attitudes could have impacts down the line.
So we get one slide for benefit costs. Modest additional costs, about $2,500. Modest additional benefits, about $1,600, $1,700. And they're distributed across, most of them going to CPs and children. So in the short term, $2,500, $1,663, costs outweigh benefits. So two things to say. One is, so we only have the services that were delivered this year's benefits this year and next year, and so we have a measure of how much decline there was. We don't have any data on whether there's any small or declining benefits in the next year, and the next year, and the next year. And reasonable assumption, what I think of as reasonable assumptions, mean this, the benefits will outweigh the costs in the longer term. So I'm happy to say more about that, but that's sort of my bottom line. From what we can see, costs higher than benefits, But taking this out into the future, probably benefits will make up for the costs. We didn't really answer your question, did we, Chris? Or did I do okay?
Well, you kind of did, and the one
Yeah,
slide kind of
okay,
did.
yeah.
Saying,
Yeah, modest. So if you think about the amount of hours of employment services that the people in the extra services group got, it's not an intensive intervention. So you might not have expected a large increase in earnings, and surprise, that's what we see. Tim?
I had two other questions at this time.
Yeah, we're done. This is our last slide.
Yep.
One thing that this brought to mind, this study, is I'm thinking about the Paycheck Plus experiment, which gave EITC to fathers, subject them, at least in New York City, to the same child support rules and, what do you call it, money, what's the word I'm looking for?
Garnishment?
Or
No.
garnishment of money. They just seem to like it. They had a better sense of responsibility. What I understand of the results, they had a sense of responsibility too. It's okay, the money's going to the kids, which totally shocking. So maybe there's something about that. And then the second thing is, do you get a feeling from this that the tighter labor market helped everybody and helped both the control in it? I mean, it seems to me there were some labor market effects in here that cut across both groups, no matter what the services and whatever were. And yet again, could be another reason why tight labor markets are good for what we're doing. Chris may or may not agree, but I think that's important if that's what you're saying.
So I think very much so in the last point, increases in the macroeconomy made for improvements among the control group. And so it might have been hard to show differential improvements among the E's. On the other hand, they were getting more services, right? We did see, I'm going to make a point that maybe Nina would be better placed to make than me, but in some ways the characteristics of people interested in the program changed a little bit over time. So at the beginning of the period, still in recessionary period, people were anxious for employment help. By the end of the period, things going a little better, people were maybe less gung-ho committed to employment services. Does that fit or no?
We have such a large caseload, we still had needs, so we didn't really see that. But in the beginning, we saw that they didn't want anything from us. It was very combative. It was at times a little scary.
Okay.
But then after about 6 months, word started to spread, and then people were coming in asking for the service.
Yeah.
And
Thanks.
I just wanted to put up this slide, which is from the baseline that we didn't talk about, which was what was the most important reason why participants said they wanted to participate. And what I think is interesting is that the yellow and blue is very or extremely important. And you'll see child support debt, so being behind on your child support, my job situation, and my relationship with my kids are just really important things. And so that's good because we were providing child support services, employment services, and parenting services. So, good match there.
And good thing that this was, because we weren't really providing relationship services.
Right.
So this was not directly targeted at your relationship with your partner.
Right. So
The measure of service receipt is from the survey?
we have survey measures. That's what we had here, the hours. We have some measures in the administrative data for some things, like enforcement actions.
Okay, I guess I was surprised by the strength of the difference in the survey measure of services, especially for employment-related services, because employment-related services are not thin on the ground.
Yeah.
Right? And everybody's eligible for WIOA.
Right.
Yada, yada, yada.
So I will let, Lisa or Jennifer or somebody else say more, but I will say that one of the things that I really took away from the implementation analysis was that one of the concerns that grantees expressed the most was the lack of co-location of services. That even if you were in the extra services group and you were getting case management, getting the dad from the child support agency over to workforce services, even if they were just kind of around the corner, or especially if they were across town, was really a challenge. So the fact that things are in the community, it doesn't surprise me that having case management and having that active connection really made a difference to people's uptake. But other folks spent more time in the field than I did.
Yes.
Child support agencies are not required to be at the one-stop?
No.
No.
Oh, that would seem to be a policy recommendation.
But I would say even in, I know Madison say, but even in the cases where they were close to each other, it didn't necessarily mean the culture was a place for them to be working together. That was another cultural shift. Even in terms of co-location doesn't mean integration or cooperation.
Right. Right. Think about the social science building. No, but I'm just saying, how much time,
Performance management system for the child support people that is related to how much of the payments get made, and they could be referring people regularly to WIOA. It would surprise me that they're not doing that, I guess, and maybe following up and harassing them until they do it.
I would just add that there's referral and then there's uptake.
Yeah.
So
Yeah.
in many cases, it can be challenging to get somebody to go decide to engage in those services, or to make the decision to go and then follow through on those services for a prolonged period of time. There are a number of barriers that we heard about that got in the way of doing that. Sometimes that's related to the characteristics of the program themselves. Not everybody was eligible for all of the services available in the community, and sometimes it's difficult to access, and sometimes people feel like they don't need help.
Right.
That's it.
Right. And I would also say, and we didn't talk through this quote, but one of the differences here is that you will talk to many people. I just came back from a child support enforcement, or child support association meeting. There are people who feel like the child support program is mostly about collecting child support. Kind of like the tax. The Department of Revenue is about collecting tax, and they don't embrace necessarily, everybody doesn't in the child support system embrace all of this kind of broadening or mission creep or watering down the program or whatever you have. And part of what this is this is one of the project managers saying, you're having a more engaged conversation with the NCP about his life situation while you're preparing his order. You aren't just checking off information, filling in a dollar amount and slapping it over there. You're having a conversation. So this was a change in the way that folks have done things. And one of the things, again, I'm going to point to some work that Lisa's done recently. Part of it is about caseloads. It is easier to fill out a form and send it on than it is to talk to somebody who's having challenges and try to connect them with services. And one of the things that we've seen in some of the work that Lisa's done is that, places that have the time by virtue of kind of the size of the agency and the size of the caseload are often providing that kind of more customized service, not taking away your driver's license if the reason that you're missing your payments is, you just lost your job or you're having a health issue. But that takes a kind of, that takes an amount of time that is more resource intensive than is available for a lot of agencies. Hillary?
So piggybacking on that, I'm going to try to ask this in a way that you as researchers can answer it. So if you were to test a new intervention where compliance with child support was the key outcome, what would tweak or difference would you want to test?
So I think we have several ideas on this, but one thing that I would do is run a similar kind of program. So we have the observational evidence and the implementation analysis mostly suggests that the employment services and the parenting services could have been effective, but weren't robust enough. So I would do a program where I gave grantees more resources to deliver a deeper set of services. I would also run it for longer. So if the main change here is that we see this change in attitude, I would not expect immediate behavioral responses to changes in attitude. We could have a long conversation about this. But I would want to see these people who now were very satisfied and even saw the child support agency as a partner with them, had different child support outcomes down the road. Now, perhaps I'm too optimistic on this, but those are a couple things I would think about.
I think the one other thing is, there were some challenges that we identified and that grantees identified that they really weren't in a position to address. So mental health issues is a really big one. Substance abuse issues is a really big one. Some legal challenges in terms of so we didn't, I don't know, we put this up there, but 60, 2/3 of the participants roughly had been convicted, and that presents some challenges. So there were some things that, that would have been nice to add to this. Parenting time. So lots more to do. So that's why I had flipped past. So we wanted to say thank you to everybody who's in this room, because there are many people in this room who did a lot of work on this. We should note that Lonnie, I did the wrong thing. Well, there's a website.
I'll do this while you talk.
This is why Dan doesn't let me do it, because I get impatient and it's wrong. But there's a website that has already some additional reports on it, but there's a bunch more work going. Those of you who know that Dan and I finished another random assignment experiment in 2001 that we just published something off of, will not be surprised to know that we aren't finished with this one yet. And there's a lot of PhD students in this room who have worked on this project, who are doing dissertations and other things, and a lot of other colleagues. We should note that Lonnie was in charge of all the parenting stuff, in addition to contributing to lots of other things. We mentioned Lisa and Jennifer, and I should stop because I'm going to fail to mention everybody who's in the room. But Catherine's not here, but she was also a co-PI on this. So please do go and look at the things that we're already doing, and many more things to come. And thanks for your comments.